What up, everybody? How's it going? This is my student Gabriela, doctor, cardiologist, and fluent in English, bringing a 5-minute presentation about whatever she wants. So you can go, Gabriela.
So today we'll talk about how communication skills impact patient care. And I think this is important subject because in basic AI dominated world, the main thing that makes us humans distinct from the robots, the machines, and the AI is our ability to empathize with other humans. AI might be better in evaluating exams, getting a right diagnosis in a certain scenario, but is it capable of truly connecting with patients? This is the unique characteristic that makes us better doctors, and is part of a group of abilities that are called soft skills. And those skills are the ones that go way beyond our scientific knowledge. There are plenty of reasons why communication is key in the doctor-patient relationship. The first one I would say is that the patient does not read the medical book. So it's our job to understand what he tries to say and explain his symptoms and turn into a diagnosis. So we have to be able to pull the information out of the patient and use it to interpret it in a correct way to find a right diagnosis that is individualized to this patient in this scenario. So in order to do that, we have to be not only good listeners, but also knowing how to interpret it, their answers that sometimes won't use like scientific words, but maybe layman words, layman answers that we have to be able to interpret it. And this ability enhances our understanding on patients' medical conditions, and therefore let us apply a better treatment, treatment for this patient's conditions and diagnosis. But communication is not only part of this diagnosis phase of a doctor and patient relationship. It is also very important in terms of the treatment, because we might be able to explain the patient's condition and give him or her the best knowledge of their diagnosis, and then be able to explain their treatment options that will also make them adhere more to our treatment options. And another part that makes the communication a key skill in medical setting is that sometimes we have to overcome time restrictions and use it the best to understand the patients, maybe sometimes cultural difference, and sometimes also languages difference. Like with an arising of immigration, for example, here in Brazil, sometimes we have people from Haiti, I guess, Haiti or Venezuela, and we have to be able to understand their like native languages that sometimes won't be Portuguese, and sometimes they won't speak English, and we have to use it sometimes even like body language to make us understandable and understand what they are saying. So another scenario that I also see that communication is key, especially being a doctor that works in an ICU setting, is that sometimes we have to be the person that gives bad news to patients and patients' families. And the way we do so, it's sometimes as important as the information itself, because we have to be able to connect with the family and understand their feelings and be sensitive about it. Because if we can't do so, we will be just like robots. We'll be completely replaceable, because I think what makes us better in communication is the fact that we can emphasize, we can put ourselves in places, sometimes in place where the patient is and how he is suffering, and try to connect with them, with their suffering and their family, and explain its best, but also being supportive in this conversation. So I think even though I'm used to giving like bad news to patients, being the one that delivers it, it always gets me because I'm a human, you know, and sometimes we get too involved with the patient's history, and we can put ourselves in place of their families, but we have to be able to do it. Like there's a fine line between being too sensitive and not being able to kind of pass the scientific knowledge and the medical part of the thing, and not being able to empathize at all with the patient's family. Especially not only with my aunt that I basically talked earlier in the class, but also with the patient that I had a few weeks ago. It kind of got me a lot, because she was a young girl, like 35-year-old woman who was diagnosed with breast cancer, metastatic breast cancer. And I was the one who had to explain to her family that basically the cancer was evolving in a way that her organs were failing and she wouldn't survive, you know. And I also was the one who had to deliver the bad news that she actually passed away. So those situations are especially difficult for us, and are especially and are the oh my god, and are the main ones that we have to explore our ability to communicate and to emphasize and to be able to connect with their families and their suffering, to get the best support possible for them.
Okay,
So
that is more than 5 minutes because in the beginning, let me finish the video. Bye bye, everybody.
okay.
That was Gabriela.
Bye. No.
See you, Gabriela, in the future. Bye bye, Jordan from the future. See